This is CNN Breaking News.
All right, good morning to our viewers here in the United States and all around the world. It is Friday, October 1st, and we do have breaking news. What could be the first pill used to treat COVID-19. This could become a reality, and very soon. Drug maker Merck announced this morning that its antiviral drug cuts the risk of hospitalization and death for people who have COVID in half.
Merck has paused its trial and plans to ask for emergency use authorization. Now, it's important here to note that this is meant for patients who are already infected with COVID. This is not a replacement for a vaccine.
CNN Chief Medical Correspondent Dr. Sanjay Gupta here with me now. This feels like a big deal.
Yeah, I mean, this could be a big deal. We're getting all the information from the company right now itself, so it's got to go through the process that everyone knows, has learned about over the last couple of years. This emergency use authorization application means the FDA will now look at this. But as you guys just mentioned, Brianna just mentioned, this trial was paused because an independent group of advisors basically looks at the trial results and says, something's going on here.
Good. Something good is going on.
Something's good going on here, so much so that we don't think it's really even ethical to continue doing the trial if it's potentially as good as it sounds.
This is one of the things that's been missing all along, right? I'm not saying this is not a replacement for vaccines. Vaccines are still the most important thing here. But early on, before the vaccine, everyone was hoping there'd be some miracle drug that could keep you out of the hospital if you caught COVID.
Yeah, it's really interesting, John. Just historically, we think about antibiotics. There's lots of antibiotics for bacterial infections. As far as antivirals for viral infections, really in the world of HIV/AIDS, that's where most of it's been studied. There's things like Tamiflu, but there's never really been sort of the big antiviral push. There's never really been a lot of funding for it. Every time something like this happens, a potential viral outbreak, there's renewed interest. And then it kind of fizzles, having covered this for 20 years. So here now you have a couple of products. This is the one from Merck, obviously. There's another one from Pfizer that's also being investigated. That sort of all along was being studied. And the thought was, look, it's probably not going to come in time for this pandemic because we'll have a vaccine maybe or something else, or the pandemic will sort of end by the time these antivirals actually get developed. But here we are, at the end of 2021, still with the tremendous need for this. As you correctly mentioned, the vaccine still prevents people from getting the illness in the first place. This would be to treat people who are mildly ill, moderately ill, to keep them from getting into the hospital. Very important, potentially, especially in places where there's not enough vaccine or countries where people aren't willing to take the vaccine.
What are the advantages of this, or how does this change the scenario going forward?
Well, when we talked about all the hype around hydroxychloroquine and things like that, the reason there was hype was, like, could you give something to people who were mildly, moderately ill, a pill that they could take at home and prevent them from going to the hospital? Everyone thought, look, it's a little bit of a pipe dream. Remdesivir sort of came close, but further trial results did not show it to be as promising. Hydroxychloroquine, ivermectin, never had data behind it. Hydroxychloroquine may be even potentially problematic, harmful to patients. Monoclonal antibodies was sort of the only thing potentially that could do that. Requires an infusion, about $2,000 a dose. Here you're talking about 5 days, twice a day, of a pill that could potentially, what it does, it basically interferes with how the virus replicates. So you got the virus in your body, it's replicating. This comes in and basically, in various ways, stops that replication process from happening. So if it works, and again, lots of ifs here, because the FDA's got to look at this. Remdesivir had a lot of promise as well. This sounds really promising, but it's got to be further analyzed. If it works, then this is something people could have in their homes, potentially take after they're diagnosed, after they get a positive test, before they get really sick, and really change the trajectory of their disease.
Wall Street Journal calls it Tamiflu for COVID.
Yeah, I think that's the only antiviral we really think about outside of the world HIV/AIDS is Tamiflu. It could sort of usher in a new era when it comes to antivirals. Everybody knows antibiotics. Most people couldn't name a single antiviral. This will be the first one maybe they could ever name.
All right, don't go far, Sanjay. You're going to come back in a little bit. An interesting development combined with vaccines may be powerful weapons against this.